Hello and welcome to this Avelle Negative Pressure Wound Therapy System application video. In this video, we will be focusing on the prophylactic application of the Avelle system following hip surgery. Avelle Negative Pressure Wound Therapy System consists of an Avelle dressing that lasts for up to 7 days and an Avelle Negative Pressure Pump that lasts for up to 30 days. The packaging also contains tubing and batteries that may need to be replaced up to the 30-day duration of the pump. Start by partly removing the backing from the dressing and position over the incision. However, if you prefer, you can remove all the backing at once. The incision should fit within the hydrofiber pad area with at least 1 centimeter overlap to the surrounding skin. Ensure that the port is positioned away from the wound uppermost, over intact skin. Remove the remaining of the backing carefully and smooth the dressing borders around the incision, securing it in place. Avoid creases in the adhesive border, but if this happens, simply reposition if required. If preferred, check your seal is achieved prior to applying the acrylic fixation strips by inserting the batteries into the pump. All the indicator lights will flash once. Next, connect the dressing to the tubing via the Lure lock connection. You will need to twist the connections together, being careful not to over-tighten. Then connect the remaining tubing to the pump. If a shorter connection is needed, the dressing can be connected directly to the pump. Press the blue button on the front of the pump for 3 seconds to commence negative pressure. The green indicator will start to flash to tell you the pump is working effectively and will continue to flash to let you know the system is turned on and functioning properly. If an air leak is detected, this will be indicated by a flashing yellow light. If this is not rectified, the pump will turn off after 30 seconds. Ensure the dressing is properly stuck down and smooth out any creases in the dressing border and fixation strips where there may be a leak. Also check the tubing connectors are fastened together. In order to maintain a good seal during the duration of the dressing, now apply the acrylic fixation strips to the dressing. 6 fixation strips come with the dressing and they are all the same size. The strips have release liners. Follow the 1, 2, and 3 numbers to apply the strips correctly. Apply the fixation strips with about 1 centimeter overlap onto all sides of the dressing. Please do not stretch the fixation strips. The strips can be cut, especially for smaller size of the dressing, or if you prefer to work with smaller strips, which I have shown here. Smooth the strips to help achieve and maintain an effective seal. Be sure not to trap the tubing with the acrylic strips. Continue to smooth the strips. If you haven't already, please turn on the pump by pressing the blue button for 3 seconds. To turn off the pump, hold the blue button for 3 seconds. To remove the dressing, carefully stretch the fixation strips parallel to the skin around the whole of the dressing. Then remove the fixation strips, which are no longer on the patient's skin, along with the Avelle silicone dressing, away from the skin. Thank you for watching Avelle negative pressure wound therapy application video for surgical incisions on hips. Avelle combines globally proven and trusted hydrofiber technology with up to 30 days of negative pressure therapy to help close the most challenging of wound incisions. For further information, please use the information on screen.